I'm Dr. Angela Dearinger, Commissioner for Kentucky's Department for Public Health. Today I want to provide the latest information on a concerning outbreak of e-cigarette or vaping-associated lung injury, also known as EVALI, E-V-A-L-I. Kentucky continues to monitor and investigate a growing number of cases of severe pulmonary disease associated with e-cigarette use or vaping. As the investigation into the cause continues, we urge you to advise your patients to refrain from using e-cigarettes or vaping products. As of October 22nd, a total of 30 cases are under investigation in Kentucky. 4 of the cases have been ruled out, 6 are probable, and 2 cases have been confirmed as EVALI. Patients suffering from EVALI are reporting respiratory symptoms such as cough, shortness of breath, and chest pain. They may also experience constitutional symptoms such as fever and fatigue, and GI symptoms such as nausea and diarrhea. In most cases, these symptoms worsen over a period of days or weeks before admission to the hospital. Despite the accumulating data on the clinical and imaging features of vaping-associated lung injury, its pathology is still poorly understood, and the specific agent responsible for the lung injury remains unknown. As a physician, what do you need to do? The CDC provides guidelines specifically for healthcare professionals. First, report cases of lung injury of unclear etiology and a history of e-cigarette use within the past 90 days to the Kentucky Department for Public Health. Reporting of lung injury cases may help CDC determine the cause of the lung injuries. If e-cigarette use is suspected as a possible etiology of a patient's lung injury, obtain a detailed history, including substances used, nicotine, cannabinoids of any type, flavor, or any other substances, devices used, and if those devices have been modified in any way, where the products were purchased, and the method of use. Was it aerosolized, dabbing, or dripping? If you don't know what those terms mean, I encourage you to look it up. For patients who report use of e-cigarettes, physical exam should include pulse oximetry. Pulmonary findings on auscultation have often been unremarkable, even among patients with severe lung injury. Patients with suspected EVALI should be admitted to the hospital if they have an oxygen saturation below 95% on room air or are in respiratory distress. Outpatient management might be considered on a case-by-case basis for patients with less severe illness, as long as they have follow-up within 24 hours. A chest x-ray should be obtained on all patients with a history of vaping who have respiratory or GI symptoms, particularly when accompanied by a decreased oxygen saturation. Chest CT might be useful when the chest x-ray result does not correlate with clinical findings or to evaluate severe or worsening disease or other illnesses in the differential diagnosis. Radiographic findings consistent with EVALI include pulmonary infiltrates on chest x-ray and opacities on chest CT. Patients discharged from the hospital after inpatient treatment of EVALI should have a follow-up visit no later than 1 to 2 weeks after hospital discharge. Advising patients with suspected or confirmed EVALI to discontinue vaping is an integral part of the patient's care. Cessation of vaping might speed recovery. Resuming use of e-cigarettes has the potential to cause recurrence of symptoms or lung injury. For more specific guidance on clinical care for a patient with vaping-associated lung injury, including lab and infectious disease testing, see the CDC's updated interim guidance for healthcare providers on the CDC's website. Lastly, I would say, we know that some adults have used e-cigarettes to attempt to quit smoking. However, e-cigarettes are not currently approved by the FDA as an aid to quit smoking. What we do know is that people are dying from vaping-related lung injury, and we know that youth are much more likely than adults to use e-cigarettes. Again, I urge you to advise your patients to refrain from using electronic cigarettes and to talk with their children and grandchildren about the dangers of e-cigarette use. Thank you for your time and attention to this serious public health concern.